Welcome back to the Deep Dive. Today we're really getting into something that affects so many people, often without them even realizing it, until it's, well, quite serious. We're talking about osteoporosis.
Right, the silent disease. It's a really accurate nickname,
It
unfortunately.
really is, because it sort of creeps up on you,
Yeah,
weakening bones from the inside out, affecting that internal structure. What's it called? The microarchitecture.
exactly. The microarchitecture, it deteriorates, making bones incredibly fragile. And that leads to a much higher risk of fractures, especially hip, spine, wrist fractures, which can be just devastating.
Devastating, yeah. We see the impact everywhere. The pain, the loss of mobility, the sheer cost,
Yeah.
especially for older adults,
Yeah,
particularly postmenopausal women. So understanding this is, I think, really vital for you, our listener.
it absolutely is. And our goal today, our mission for this deep dive, is to take a really critical look, an evidence-based look at herbal remedies, but specifically as adjuncts.
Adjuncts, that's the key word here, isn't it?
It really is. We're not talking about miracle cures or replacements for your doctor's advice. We're exploring options that have some scientific backing, things that might complement conventional treatments when used carefully.
Because those conventional treatments, things like bisphosphonates or hormone therapy, they're the mainstays, but they aren't perfect for everyone, are they?
No, they definitely have challenges. Side effects can be a major issue for some people, affecting whether they stick with the treatment.
Uh-huh.
And then there are sometimes questions about how well they work long term for certain individuals, and just, adherence taking medication consistently for years is tough.
It really is. So it makes sense that people are looking into other avenues like phytotherapy, herbal medicine.
Exactly. And that's what we want to equip you with today, the knowledge, the nuances, the critical thinking tools to really understand these options and make informed choices about your bone health.
Great. So to really grasp how herbs might help, we need to understand the condition itself first. Let's get into the bone story. What is osteoporosis beyond just, brittle bones?
Well, it's much more complex than that. As you said, it's a systemic skeletal disorder. Think of your bones not as static blocks, but as living tissue that's constantly being remodeled.
Like a construction site.
Kind of, yeah. A
Uh-huh.
construction site where old material is constantly being removed and new material laid down. But in osteoporosis, that internal framework, that microarchitecture we mentioned, gets compromised. The supports get thinner, the connections break down.
So the whole structure weakens, not just the outer shell.
Precisely, which leads to that increased fragility and the high risk of those specific fractures, hip, spine, wrist, that have such a massive impact on quality of life and healthcare systems, especially for older populations.
And going back to the treatments, the conventional ones, we know they're important. But those hurdles, the side effects, long-term questions, adherence,
Yeah.
they really push people to explore complementary strategies.
They absolutely do. And that's why this conversation about herbs as potential adjuncts is so relevant.
Adjuncts again, let's really hammer that home.
We have to, because it's crucial. We are not suggesting herbs as standalone cures or replacements for doctor-prescribed treatments or essential lifestyle factors like calcium, vitamin D, and exercise.
Right.
Instead, we're looking at them as tools that might, when used safely and appropriately under guidance, support the overall plan. Enhance it, perhaps.
Okay, that's crystal clear. So if herbs are adjuncts, where do they fit into that bone remodeling process you mentioned? How do they actually intervene?
Okay, so bone remodeling is this continuous cycle. You have cells called osteoclasts. Think of them as the demolition crew breaking down old bone. And you have osteoblasts, the builders forming new bone.
And in healthy bone, demolition and construction are in balance.
Exactly, beautifully balanced. But in osteoporosis, that balance gets thrown off. The osteoclasts, the demolition crew, start working overtime, resorbing bone faster than the osteoblasts can build it back up.
So net bone loss.
Net bone loss. And what's fascinating is that many promising herbs seem to target the specific molecular signals, the pathways that control this balance. They try to, rein in the demolition crew or give the builders a boost.
Interesting. So what are some of these key pathways? How can a plant compound even influence something so specific?
Well, one of the absolute master regulators is something called the OPG rank axis. Think of it as the command center for osteoclast formation.
Okay. OPG, rank-L, rank.
Right. So osteoblasts, the builders, actually produce a signal called rank-L. When rank-L binds to its receptor, rank, on immature osteoclast cells, it tells them, okay, mature and start breaking down bone.
So rankle is the go signal for bone resorption.
Pretty much, yeah. But the osteoblasts also produce another protein called OPG, osteoprotogerin. OPG acts like a decoy. It floats around and grabs onto rank allele before it can bind to rank.
Like intercepting the message.
Exactly. It neutralizes the go signal. So the
Yeah.
ratio between OPG and rank allele is absolutely critical for balanced bone turnover. Too much rank allele relative to OPG, and you get excessive bone breakdown.
And herbs can affect this ratio.
Yes, that's a key mechanism for many of them. They might work by encouraging the body to produce more OPG, the decoy, or by reducing the production of RNKL, the go signal, or sometimes both. They help nudge that balance back towards bone preservation.
Clever, so they can slow down the demolition. Can they also help the builders, the osteoblasts?
They potentially can, yes. There are other pathways involved in promoting the builders. For instance, the wentocatinin pathway and the bone morphogenetic protein, BMP pathway. These are crucial for telling stem cells to become osteoblasts in the first place, and then helping those osteoblasts function properly and survive longer.
So herbs might activate these building pathways too.
Some herbs appear to do just that, providing direct support for bone formation. It's often a multi-pronged attack, so to speak.
And what about the hormonal aspect, especially after menopause? Estrogen loss is a huge factor, right?
Absolutely huge. That drop in estrogen is a major driver of postmenopausal osteoporosis because estrogen normally helps keep the osteoclasts in check. This is where phytoestrogenic activity comes in.
Phytoestrogens, plant estrogens.
Sort of, yeah. Many plants contain compounds that have a structure similar enough to our own estrogen that they can bind weakly to estrogen receptors in the body.
Weekly, so not like HRT.
No, definitely not as potent as pharmaceutical estrogen, but this weak binding can still exert a gentle, beneficial bone protective effect, mimicking some of estrogen's roles in slowing down bone resorption. It's a really important mechanism for several key herbs we'll discuss.
Okay, so we've got influencing the OPG-RNKL balance, stimulating bone-building pathways, and this phytoestrogen effect. Anything else? What about inflammation?
That's the other really big piece of the puzzle, and it's gaining a lot more attention. The role of chronic, low-grade inflammation and oxidative stress.
How does that affect bone?
We now understand that this constant low-level inflammation creates a hostile environment in the bone. It actually encourages osteoclast activity, fuels the demolition crew, while at the same time hindering the osteoblasts, the builders. Oxidative stress from free radicals also damages bone cells directly.
So inflammation actively works against bone health.
It really does. So herbs that have strong anti-inflammatory and antioxidant properties are really valuable. By calming that inflammation and neutralizing those damaging free radicals, they help create a much healthier, more balanced environment for bone remodeling to occur properly.
Wow, okay. That paints a much clearer picture of how these herbs might actually work at a cellular level. But before we jump into specific herbs, we absolutely have to lay down the ground rules.
Part 2. The essential framework, safety, evidence, and making smart choices, and the absolute #1 rule.
Natural does not automatically mean safe.
Cannot stress that enough.
Especially for older adults.
Mm-hmm.
Just because something comes from a plant doesn't mean it's harmless. Elderly individuals often have multiple health conditions. They're taking multiple medications. Their bodies process things differently. They're just more vulnerable to potential adverse effects.
And we're not just talking mild stomach upset, are we? There can be serious risks. Absolutely. There's direct toxicity. We've seen reports of serious liver damage, hepatotoxicity with herbs like Sorelia coralifolia, for instance. And then there's the huge issue of contamination in supplements that aren't properly regulated.
Like heavy metals.
Exactly. Raw shilajit, which we'll talk about later, is notorious for potentially containing high levels of lead, arsenic, mercury, even fungi. Ingesting those is obviously incredibly dangerous. You have to be so careful about the source and quality.
That's terrifying. And what about interactions with prescription drugs? So many older adults are on multiple medications.
That's probably the biggest minefield. The potential for drug-herb interactions is massive and often overlooked. Herbs can affect blood clotting, for example. If you're on warfarin or even just aspirin or ibuprofen, certain herbs could dangerously increase bleeding risk.
Okay.
Others can affect blood sugar, potentially causing hypoglycemia if you're on diabetes meds. Some affect blood pressure, risking a dangerous drop if combined with antihypertensives.
And the liver enzymes.
Yes. The cytochrome P450 system, CYP3A4, CYP1A2, and so on. These enzymes metabolize a huge number of common drugs. Many herbs can either inhibit or induce these enzymes.
Meaning the drug levels could become toxic or the drug might not work at all.
Precisely. It can completely throw off the effects of everything from statins to antidepressants to heart medications. It's incredibly complex.
Okay, this sounds really serious. So if there's one takeaway message for you, our listener, about safety, What is it?
It's simple and it's non-negotiable. Do not use any herb or supplement to treat or manage osteoporosis without talking to your doctor or another qualified healthcare professional first. Full stop.
Why is that absolutely essential?
Because they understand your specific health situation. They can review all your medications to check for those dangerous interactions. They can help you find high-quality tested products. They can monitor you. Trying to navigate this alone, especially with a condition like osteoporosis and potentially multiple medications, is just too risky. You need that expert guidance.
Absolutely. Okay, with that huge disclaimer firmly in place, let's talk about evidence. How do we know if an herb actually works? What's the journey from a lab idea to something proven in humans?
It's a long journey, usually. It often starts with preclinical data. That means studies done in vitro in lab dishes on cells or in animal models, usually mice or rats.
And what does that tell us?
It tells us how an herb might work. It helps identify active compounds, understand potential mechanisms like affecting that OPG or NKL pathway, and gives us a scientific reason to investigate further. It shows promise, basically.
But promise isn't proof, right? Especially not proof in people.
Exactly. What works in a petri dish or a mouse doesn't always translate to humans. The gold standard for proving something works in people is the randomized controlled trial, or RCT.
That's where you compare it against a placebo.
Right. Participants are randomly assigned to get either the herb or a placebo, or sometimes the standard treatment. This randomization minimizes bias, and the comparison shows if the herb actually provides a real benefit beyond the placebo effect. Strong, well-designed RCTs are what give us solid human proof.
And for many herbs, even popular ones, that level of evidence just isn't there yet, is it?
That's often the case, yes. There might be lots of promising preclinical data, maybe some small or preliminary human studies, but not enough large, rigorous RCTs to be definitive. And it's crucial for you, the listener, to understand that distinction. Is this just a lab finding, or is there solid human evidence? We'll be very clear about that as we discuss specific herbs.
Excellent. Okay, framework established. Let's dive into part 3.
Mm-hmm.
Spotlight on key herbal players. We'll start with herbs that actually do have strong human clinical evidence for osteoporosis. First up, Epimedium spp, maybe better known as horny goatweed or yin-yang hu.
Yes. Epimedium is a great starting point. It's a classic in traditional Chinese medicine, often used for vitality and, importantly, strengthening bones linked to kidney energy in TCM. Mechanistically, its main active compound is icariin.
Icarins.
And icariin is quite sophisticated. It acts as a phytoestrogen, so it weakly mimics estrogen, which is beneficial postmenopause. But it also directly stimulates osteoblast activity, encourages bone building, and it inhibits osteoclast activity, slowing down bone breakdown.
So it works on both sides of the equation, building up and slowing demolition. That sounds powerful. Does the human evidence back that up?
It does, yes. For Epimedium, the human evidence is considered quite strong. There have been multiple studies, and importantly, a meta-analysis of several RCTs looking specifically at Epimedium or icariin for osteoporosis.
And what did that meta-analysis find?
It consistently showed positive results, things like significant increases in bone mineral density, BMD, a direct measure of bone strength. It also showed improved therapeutic rates, meaning more patients showed clinical improvement, and some studies even reported reduced pain.
Wow, reduced pain too.
Yes, which is a really important clinical outcome for patients. So the evidence really elevates Epimedium beyond just promising.
Okay, that's compelling evidence.
Yeah.
But something that potent, especially with hormonal effects, safety must be a big consideration.
Absolutely. Huge considerations. Because of its phytoestrogenic activity, it's strongly contraindicated, meaning absolutely should not be used by anyone with hormone-sensitive cancers like breast or uterine cancer.
Right.
Also contraindicated in pregnancy and for people with bleeding disorders or who are about to have surgery because it can affect blood clotting. High doses might cause dizziness, nausea, or even rarely respiratory or heart issues.
And drug interactions, that's always a worry with older adults on multiple meds.
Yes, the potential is significant. Because it affects clotting, it can interact dangerously with anticoagulants like warfarin, antiplatelet drugs like clopidogrel, even NSAIDs. It can also lower blood pressure, so interactions with antihypertensives are a concern. And critically, it interacts with those liver enzymes, the CYP450 system, potentially affecting levels of many, many common drugs. And it could amplify effects if taken with actual estrogen therapy.
So, bottom line, strong evidence, but absolutely requires expert medical supervision due to safety and interactions.
Without a doubt. Essential.
Okay. Next on our list with strong human evidence. Resveratrol, We hear a lot about this from red wine and grapes for heart health and anti-aging. What about bones?
Resveratrol is fascinating. It's a polyphenol found in grape skins, berries, peanuts, and yes, it holds real promise for bone health too. Its biggest strengths are probably its potent antioxidant and anti-inflammatory effects.
Ah, tackling that inflammation and oxidative stress we talked about.
Exactly. It helps create a healthier environment for bone cells. Plus, it also acts as a phytoestrogen, giving that gentle estrogen-like support, which is especially relevant after menopause.
How does it work at the cellular level in bone?
It seems to do several things. It enhances the function of osteoblasts, the builders, partly by activating pathways like SIRT21 and AMPK, which are involved in cell health and longevity.
Okay.
And at the same time, it inhibits the formation and activity of osteoclasts, the demolition crew, partly by suppressing that on-NKO pathway. And its antioxidant action protects bone cells from damage. So again, multiple beneficial actions.
Sounds good mechanistically. How strong is the human evidence for resveratrol and bone density?
It's actually quite strong. The key study is the Reshaw trial resveratrol for healthy aging in women. This was a solid 24-month randomized placebo-controlled trial.
Gold standard.
Exactly. And it found significant benefits. Postmenopausal women taking 75 milligrams of resveratrol twice daily showed significant increases in bone mineral density in both the lumbar spine and the femoral neck key fracture sites.
Wow, actual increases in BMD.
Yes, and importantly, it also significantly reduced a key marker of bone resorption by over 7%. So it was clearly slowing down bone breakdown. And even more impressively, the improvement in femoral neck BMD was enough to significantly lower the calculated 10-year risk of major fractures and hip fractures.
That's a real clinical impact.
It is. And interestingly, the benefits were even greater when women also had adequate vitamin D and calcium intake, pointing to a synergistic effect.
Very interesting. What about safety for resveratrol? It seems quite widely available.
Generally, it's considered very safe, even at quite high doses in studies like up to 1,500 milligram daily short-term. The most common side effect is mild stomach upset, usually at higher doses.
Any major cautions?
The main theoretical cautions are due to its known effects. It might slow blood clotting slightly, so caution with bleeding disorders or anticoagulant meds is wise. And because it's a phytoestrogen, caution with hormone-sensitive conditions is usually advised, though its effects are weak. Interactions are mainly with blood thinners and some liver enzymes. The biggest practical challenge is actually its low bioavailability getting enough absorbed to be effective. Research is ongoing into better delivery methods.
Okay, so generally safe, good evidence, but maybe needs specific formulations.
Got it.
Let's move to Rhizoma drainaria. It has that amazing traditional name, Gusuibu, or mender of shattered bones.
Yes, that name tells you a lot. Gusuibu is a cornerstone herb in traditional Chinese orthopedics, used for centuries specifically to heal fractures, damaged ligaments, and treat osteoporosis. It has a very long, focused history of use for bone problems.
Does modern science back up that ancient reputation?
It really does. The active components are mainly total flavonoids, often called TFRD, including things like naringin. These are so well regarded that they've been developed into a licensed Chinese medicine, Changu capsule, specifically for osteoporosis.
That was actually approved as a medicine in China.
Yes. Mechanistically, TFRD promotes bone formation. It increases OKG, decreases RA-NKL, stimulates those 1-catenin and BMP pathways we talked about, and it inhibits bone resorption. A very comprehensive action.
Sounds impressive. What about the human RCT evidence?
It's strong. A meta-analysis combined data from 6 RCTs with over 800 patients. It found that Gusuibu, often as the Kango capsule, led to significant increases in BMD compared to conventional treatments. It showed clear therapeutic effects in human trials.
Okay, strong evidence. Now, the crucial question for our listeners, safety and drug interactions.
This is where Gusuibu really shines, especially compared to other potent herbs. It's generally very well tolerated. In that large meta-analysis, adverse reactions were rare and mostly minor stomach upset.
Interactions.
Here's the significant advantage. There are no well-documented major drug interactions reported for Rhizoma drainaria. While you always need to talk to your doctor before starting anything, this lack of known major interactions makes its safety profile stand out, particularly for older adults on multiple medications. It simplifies things considerably.
That is a huge plus. Wow. Okay, now for something completely different, a common kitchen herb, thyme, Thymus vulgaris. Surprise potential here.
Definitely a surprise for many. Thyme is much more than a flavoring. Its benefits for bones seem linked to its potent antioxidant and anti-inflammatory compounds like thymol and carvacrol.
Ah, tackling inflammation again.
Exactly. Animal studies showed it inhibits bone loss, improves BMD, even increases calcium and vitamin D levels, and reduces inflammatory markers like CRP and TNF-alpha. One study even found it better than rosemary for bone loss caused by calcium deficiency.
Okay, strong preclinical signs. But the big question, has thyme actually been studied in humans for osteoporosis? That seems unlikely for a simple kitchen herb.
That's what makes this so remarkable. Yes, it has. There is direct human clinical evidence. Recent trials in postmenopausal women using thyme supplementation 500 milligrams twice daily for 6 months showed significant increases in BMD and P scores,
Compared to placebo.
compared not just to their baseline, but also significantly better than standard treatments like calcium plus vitamin D or even the drug alendronate alone.
Wow, better than alendronate alone.
In those specific trial parameters, yes. And even more interesting, when thyme was added to alendronate, the improvement in BMD was significantly greater than with alendronate by itself.
That shows real synergy.
It really does. It suggests thyme can actually enhance the effects of conventional osteoporosis drugs. This moves thyme from the maybe beneficial category straight into clinically observed effects in humans. It's quite extraordinary for a common herb.
Truly remarkable. And its safety profile for medicinal use like that.
Generally excellent. It's considered very safe short-term. Side effects are rare and mild, maybe some stomach upset. As it has very weak phytoestrogenic effects, the usual caution for hormone-sensitive conditions applies. And there's a theoretical interaction risk with blood thinners, though evidence seems limited compared to others. Overall, its high safety margin plus this new human data makes it a really accessible and potentially valuable adjunct.
Amazing. Okay, we've hit some strong contenders. Now let's move to herbs with maybe emerging or moderate evidence and look at some combinations. First, Salvia multimyrza, danchin, or red sage.
Danchin is a major herb in TCM, especially known for circulation or moving blood, but it has significant effects relevant to bone, too. It decreases Ra and KL, inhibits another enzyme called cathepsin K involved in bone breakdown.
Slowing demolition again.
Right. And it stimulates the wantacatinin pathway for bone formation, boosts osteoblast markers, plus it has strong antioxidant and anti-inflammatory actions from its salvionolic acids, and potentially mild estrogen-like effects.
Sounds like it hits a lot of targets.
Yeah.
What's the human evidence for osteoporosis specifically?
It's considered moderate, but promising. There aren't really standalone RCTs just on danchin for osteoporosis yet. However, it's a key ingredient in many TCM formulas used for bone health. There's a large body of evidence, like 38 clinical trials reviewed using these danchin-containing formulas, showing high efficacy rates, often between 77 and 97%.
So effective in formulas, but hard to isolate danchin's specific contribution.
Exactly. The formula context makes it tricky, but the consistent positive results are definitely suggestive. We need more trials on danchin alone to really solidify its individual evidence.
And safety, given its strong circulatory effects.
Caution is definitely needed here. Side effects can include itching, stomach upset, but the main risks relate to its blood-moving properties. Potential for bleeding problems, low blood pressure. It absolutely must be stopped 2 weeks before surgery.
And interactions.
Major ones. It can significantly potentiate anticoagulants like warfarin, very dangerous. It also interacts with blood pressure meds like calcium channel blockers and ACE inhibitors. So potent herb, but requires very careful professional supervision due to these risks and interactions.
Definitely high caution there. Now, what about combining two well-known anti-inflammatories, Nomacil curcumin from turmeric and Nigella sativa oil, black cumin seed? Is there synergy there for bone?
This is a really exciting area. Individually, they're powerhouses. Curcumin is famed for its anti-inflammatory antioxidant effects, plus it regulates OPG or NKL and wantacatinin. Nigella sativa, with its main compound, thymoquinone, is also strongly antioxidant and anti-inflammatory.
So a double whammy against inflammation. What happens when you put them together for bone health in older adults?
There was a significant randomized, double-blind, placebo-controlled trial, good quality study on 303 postmenopausal women with osteopenia or osteoporosis. Everyone got standard care, alendronate plus calcium vit D. Then they were randomized to get placebo, curcumin alone, or the combination of nanomicelle curcumin and Nigella sativa oil, CURNNS.
And the result?
The really interesting finding was in alkaline phosphatase, or ALP, a marker of bone formation and turnover. The CORNS group, the combination group, showed a significant reduction in ALP compared to both placebo and curcumin alone, even after adjusting for lots of other factors.
A unique effect only seen with the combination.
Exactly. It suggests a true synergistic or enhanced effect on regulating bone turnover that wasn't achieved by curcumin alone. It points towards the combo being more effective in modulating that specific aspect of bone metabolism.
Very cool. And was the combination safe for these women?
Yes, the study found both nanomicelle curcumin and Nigella sativa oil were safe at the doses used. There were no significant differences in liver or kidney function markers between the groups, which is reassuring. Turmeric generally has a great safety profile. Nigella sativa on its own can have interactions, especially with blood thinners and blood pressure meds, so even with a safe combo trial, individual medical oversight is still crucial.
Good to know. Okay, next. Cissus quadrangularis, or hadjod. Another one known traditionally for fracture healing, right?
Yes, the Velt grape, very well known in Ayurveda for exactly that, speeding up bone healing. Mechanistically, it seems to work by reducing osteoclast activity and boosting fracture healing markers like osteopontin. It also contains some natural anabolic compounds and antioxidants.
Does modern human evidence support this traditional use?
There's moderate evidence, yes. One human trial showed it helped delay bone loss in people with osteopenia, the stage before osteoporosis. And other trials have confirmed its traditional reputation by demonstrating faster fracture healing times in patients taking Cissus.
So evidence for both density and repair. What about safety and interactions? Especially important if someone's recovering from a fracture.
Cissus is generally considered quite safe. Side effects are usually mild, maybe headache, gas, dry mouth, and not common. And here's a big plus. Like rhizoma drainaria, there are no major documented drug interactions with Cissus quadrangularis.
Another one with a clean interaction profile.
Yes, which makes it a really attractive option as an adjunct, potentially causing fewer complications with other medications. Of course, it's usually avoided in pregnancy breastfeeding due to lack of specific data.
Okay, strong candidate there. Now, let's briefly touch on a specific formula again. Shanlin-Gubao capsule, or XLGB, you mentioned it's widely studied.
It is. It's a multi-herb TCM formula specifically for osteoporosis. And a large systematic review and meta-analysis looked at 20 RCTs with almost 2,000 participants, many with age-related or postmenopausal osteoporosis.
And what did that review find when XLGB was added to standard treatment, like alendronate?
It found really remarkable benefits. The combination significantly increased BMD at the lumbar spine, femoral neck, and wards area compared to alendronate alone. It also improved bone turnover markers, indicating better bone metabolism and significantly reduced pain scores.
Improving density, markers, and pain relief. That sounds great. But adding a complex formula to a drug, what about safety? Did it increase side effects?
Crucially, the analysis found that adding XLGB did not markedly increase the rate of adverse reactions compared to alendronate alone. Reported side effects were generally mild, some GI discomfort, minor liver function changes, maybe menstrual irregularities. This suggests it's a relatively safe and effective add-on strategy, enhancing the benefits of conventional therapy without significantly increasing the safety burden.
Very promising as an integrated approach. Okay, let's shift perspective slightly in part 3.3. Look at some broader insights, maybe new markers or mechanisms relevant to elderly bone health coming from larger studies.
Right, sometimes population studies reveal interesting correlations. For example, one large study looked at over 9,000 older Americans, aged 50 plus. It investigated a novel blood marker, the hemoglobin to red cell distribution width ratio, HRR.
HRR, what's that based on?
It's calculated from two very standard blood tests. Hemoglobin and red cell distribution width, RDW, which measures variation in red blood cell size. Both are part of a routine complete blood count.
And what did they find about HRR and bone health?
They found a significant positive correlation between HRR and T-scores at the femur. Higher HRR meant better bone density, and conversely, a negative correlation with osteoporosis occurrence, higher HRR, meant lower risk.
Interesting. So this easily calculated ratio from routine bloods might be a useful indicator of bone health in the elderly.
It seems potentially useful, yes. It highlights how we can sometimes find new insights or risk indicators hidden within readily available data. It's a different angle on assessing bone health.
Cool. Any other specific compounds showing promise, maybe from animal studies relevant to aging?
Yes, the compound ostol is worth mentioning. A meta-analysis looked at 13 rat studies, some specifically using models of senility-induced osteoporosis mimicking age-related bone loss.
And what did ostol do in these models?
It significantly increased BMD, but more than that, it also improved bone biomechanical properties, meaning the actual strength and resilience of the bone. It increased the maximum load the bone could take before breaking and improved stiffness.
So not just denser, but structurally stronger bone. How does it work?
It seems to primarily promote osteoblast differentiation, making more bone builders, possibly through those key 1-to-catenin and BMP2 pathways. While it's animal data, it reinforces those key mechanisms we keep seeing and points to potential future avenues for tackling age-related bone loss.
Fascinating how these themes keep recurring. Okay, we've covered a lot of ground. Now, we absolutely must turn to part 4. Important considerations, focusing on herbs that might be popular or have potential, but come with really significant cautions. High potential, high caution. And top of the list, Shilajit. You flagged this one earlier as buyer beware.
Yes, Shilajit needs a big warning label. It's not really an herb. It's a mineral-rich resin from Himalayan rocks, formed over centuries from decomposed plants. In Ayurveda, it's highly revered, called destroyer of weakness, used for energy, vitality, and yes, bone density. Its main component is fulvic acid, a strong antioxidant, plus lots of minerals.
Sounds amazing. So what's the huge beware part?
It's all about purity and contamination. While properly purified Shilajit has shown some promise in limited human studies, like a 2022 study showing reduced bone loss markers in postmenopausal women with osteopenia, the massive risk comes from raw, unprocessed products.
And what's wrong with raw Shilajit?
It's frequently found to be heavily contaminated with toxic heavy metals, lead, arsenic, mercury, alarmingly high levels sometimes, plus fungi and other impurities. This isn't a minor risk. It's potentially very harmful.
That's incredibly dangerous, especially for long-term use or in vulnerable populations.
Absolutely. So if you ever consider Shilajit, it must be from a highly reputable source that provides a certificate of analysis, Shigoe, proving it's been rigorously tested and is free from heavy metals and contaminants. Without that guarantee, the risk is simply too high.
So quality sourcing is absolutely non-negotiable. Any other interactions?
Purified Shilajit might interact with blood thinners and diabetes medications, so medical consultation is still essential, even if you find a trusted source. But the contamination risk is the overriding concern here.
Got it. Shilajit, extreme caution and verified purity needed. Now let's talk immunomodulators, herbs affecting the immune system that have major contraindications. First, Astragalus membranaceus, or Huang Qi.
Astragalus is a very important ketonic in TCM, used to boost energy, strengthen immunity. Its link to bone health is often indirect through improving overall vitality and potentially stimulating precursor cells for osteoblasts in the bone marrow.
So, general strengthener. What are the specific safety red flags given its immune effects?
While generally well tolerated, the main issue is its immune-stimulating property. Because it can ramp up immune activity, it is strongly contraindicated for people with autoimmune diseases, rheumatoid arthritis, lupus, MS, Hashimoto's, etc. It could potentially make these conditions worse.
Makes sense. Any other groups who should avoid it?
Generally not recommended in pregnancy, breastfeeding, or for young children due to lack of safety data.
And drug interactions must be complex with an immune herb.
Very complex. It can interfere with immunosuppressant drugs, making them less effective, a critical issue for transplant patients or those with severe autoimmune conditions. It might interfere with anti-estrogen cancer drugs like tamoxifen. It can affect blood clotting, interacting with blood thinners. It may also interact with blood pressure meds, diuretics, even lithium. The list is long and serious.
Wow. Definitely needs expert guidance.
Essential. It's not a simple herb to use therapeutically.
Okay. Next, another very popular adaptogen with Thenia somnifera, ashwagandha. How does it relate to bone and what are the cautions?
Ashwagandha is famous in Ayurveda for helping the body adapt to stress, primarily by modulating cortisol levels. The link to bone is indirect. Chronic stress and high cortisol are known to be bad for bones. They promote breakdown and inhibit building. So by managing stress, ashwagandha might indirectly benefit bone health.
Any direct evidence on bone?
Animal studies are starting to show potential for improving BMD via its active compounds with phenolides. But importantly, solid human clinical trial data, specifically for osteoporosis, is lacking right now. Studies are ongoing in older adults, but we don't have that proof yet for bone density itself.
Okay, so indirect mechanism, preclinical hints, but no human proof for bone yet. What about safety? It seems very popular.
It's generally considered safe for short-term use, maybe up to 3 months. Long-term safety isn't as well established. Common side effects are things like drowsiness, stomach upset. However, there's a rare but serious concern, liver injury. There have been several case reports linking ashwagandha supplements to sometimes severe liver problems.
Liver injury, that's a major red flag.
It is, and the contraindications are also numerous. Absolutely avoid during pregnancy and breastfeeding. Not recommended for people with autoimmune diseases as it can sometimes stimulate immunity. Caution with thyroid disorders, especially hyperthyroidism, as it might increase thyroid hormones. And avoid with hormone-sensitive prostate cancer as it could potentially raise testosterone.
And interactions.
Significant potential. Interactions with meds for diabetes, high blood pressure, immunosuppressants, sedatives, it can increase drowsiness, anti-seizure drugs, and thyroid medications. Plus, stop 2 weeks before surgery. It's another herb that absolutely demands careful medical supervision.
Right, definitely high potential, high caution. Finally, in this category, back to the kitchen, common sage, Salvia officinalis. We use it in cooking, but you mentioned the toxic side.
Yes, common sage. Its relevance to bone is mainly its phytoestrogenic activity, similar to some others we've discussed. This might help counter postmenopausal bone loss. Animal studies suggest it can inhibit bone breakdown. But like ashwagandha for bone, there are no human trials on common sage specifically for osteoporosis. The evidence is preclinical only.
Okay, so potential mechanism, but no human proof for bone. What's the toxicity issue? How can cooking sage be toxic?
It's all about the dose and preparation. Culinary amounts are perfectly safe. The danger comes with large medicinal doses or concentrated sage preparations, like essential oils or potent extracts. Common sage contains a compound called thujone.
Fujone.
Yes, and thujone is a neurotoxin. In high amounts, it can cause serious problems like seizures, vomiting, rapid heart rate, vertigo. It's why certain sage extracts or oils need to be used with extreme caution, if at all, and only under expert guidance. It's also avoided in pregnancy. It really underscores that natural doesn't mean harmless, especially when concentrated.
A very stark reminder. Okay, let's try to pull all these threads together now in part 5. The holistic vision integrating herbs for bone resilience. What were those big recurring mechanistic themes we saw?
3 main themes really stood out. First, the focus on regulating the OPG and KL axis. So many of these herbs, from epimedium and rhizoma gynario to resveratrol, seem to converge on this pathway, working to put the brakes on excessive bone resorption by either boosting OPG or reducing KL. It's about controlling the demolition crew.
Makes sense. What was the second big theme?
The critical importance of combating inflammation and oxidative stress. We saw how even common, safe culinary herbs like turmeric, ginger, rosemary, thyme are potent anti-inflammatories and antioxidants. Reducing that background inflammation creates a much healthier environment for bone cells and positively influences that OPGA and KL balance. It really supports the idea of an anti-inflammatory diet as a foundational strategy.
Right, using food as medicine in a way.
Yeah.
And the third key theme?
Phytoestrogenic activity, especially relevant for postmenopausal bone loss. Herbs like epimedium, resveratrol, even sage offer that weak estrogen-like effect that can help mitigate bone loss due to estrogen decline. But this always comes with that critical warning: potential risks for women with hormone-sensitive cancers. That dual nature means expert guidance is absolutely essential.
Okay, so considering these mechanisms and all the herbs we've discussed, what's the final takeaway? How should we really frame the role of these herbs in managing osteoporosis?
The unified conclusion has to be this: herbal interventions are thoughtful adjuncts, not cures or replacements. The absolute foundation must be the comprehensive plan you develop with your healthcare provider,
Which includes?
which includes conventional medications like bisphosphonates if appropriate, absolutely ensuring adequate calcium and vitamin D intake, and consistent regular weight-bearing and muscle-strengthening exercise. Those are the non-negotiable cornerstones.
So herbs are additions to that solid foundation, not the foundation itself.
Exactly. They can be powerful additions when chosen wisely and integrated safely. They offer potential ways to modulate inflammation, support hormonal balance, maybe directly influence bone remodeling. But this potential is only realized safely and effectively through a collaborative approach with a knowledgeable healthcare practitioner who understands your whole health picture.
So for you, our listener, what are the most practical, actionable steps you can take away from this deep dive?
Well, the safest and most accessible step is to embrace those anti-inflammatory culinary herbs. Turmeric, ginger, rosemary, thyme. Regularly incorporating them into your cooking is a low-risk, potentially high-reward way to support that healthy bone environment we talked about.
Easy enough to do. What about using the more potent medicinal herbs?
If you consider any of those, the absolute priority is quality. Find high-quality, standardized products from reputable manufacturers who test for purity and contaminants. Avoid the risks we saw with things like raw shilajit. Get that certificate of analysis if possible.
And the final, unavoidable step.
That consultation with your healthcare provider. It's not optional. The risk of drug interactions, especially in older adults on multiple medications, is just too high to navigate alone. You need that open conversation to ensure safety and appropriateness for you. They're your partner in this.
Absolutely. Well, that brings us to the end of this deep dive. Hopefully, you now have a much clearer, more nuanced understanding of the science, the mechanisms, and the crucial safety aspects surrounding herbal support for bone health.
Right. You're better equipped now to understand how these herbs might work, what the evidence really says, and why professional guidance is so indispensable. It's about empowering you to be an active participant in your health.
So here's a final thought for you to consider. How does this fascinating blend of traditional knowledge and modern science empower you to have better, more informed discussions with your doctor about a truly holistic approach to your bone health? Recognizing perhaps that achieving wellness often requires a whole symphony of strategies, working together rather than just relying on a single note. Until next time on The Deep Dive, keep asking questions and keep digging deeper.